Hello friends, today I will talk about fever. Basically think what is fever, what type of fever. So let's start. First is what is symptomatic fever. If the fever, the mild to moderate, say less than 100 degree Fahrenheit or 38 degrees Celsius, then give tablet of paracetamol 500 mg or 650 mg, Corocin, Dolo, Carpol to be repeated as necessary. If the fever is higher, 102 degree Fahrenheit to 103 degree Fahrenheit, give injection of paracetamol 2 cc/m or acetaminophen, it's Novalgin 2 cc/m. Other drug to use reduce temperature or nimesulide and aspirin. If the fever is high, in addition to these drugs, keep cold compressing of ice bag, forehead, neck, axillae and groins and sponge the skin, damp cloth, advise bed rest at home and do not expose wind sun, let patient liquid and semi-solid diet, no cold water and cold drink. The viral fever invariable associated to body headache and headache so strong analgesic like proximon NSAID combination like nimesulide paracetamol should be given. Remember, however, you should aware common cause of fever and the warning signs tell you this may not be cause of simple viral fever, especially epidemic areas, epidemic areas like malaria, typhoid, infective hepatitis and influenza. You should always rule out that condition. Other thing are complaining symptom like chills with shivering of the body. Mild chills is always there, but it is body chills, it is body lymph are shivering. It is a cause for malaria. It is the most likely cause other common urinary tract infection like cystitis or pyelonephritis and excessive somewhere and endemic areas filarias like Bihar. When patient complain fever with chills or every day and alternate day, it that associated to headache for appearing of alternate day at the same time with chills, high spike and headache diagnostic of malaria. But malaria not the some typical, so even if the fever comes say day is there are severe chills and same time every day, keep malaria mind first. Second thing, we ask fever with chills and urinary symptoms such as burning micturition, frequency micturition and dysuria. Its urinary symptoms are present. Urinary infection should be rated first urinary antibiotic light. Norfloxacin 400 mg, VD levofloxacin 500 OD with cetol or plenty of oral fluid. If there abscess, these are chills, the patient, malaria, painful swelling and then fever, abscess is present will have to inside drain by a surgeon. The problem someone hidden, it is the chest or peritoneal cavity. If they are associated leg edema or painful inguinal lymph node, then suspect filaria and test the blood of microfilariae but think of its area is endemic for filariasis. So basically its fever with associated with the marked chills, then malaria and urinary tract infection are common. Blood examination all count peripheral seminal study with the urinary examination done for correct diagnosis. Other thing, fever without chills. If the fever is associated severe body headache, throat pain, coryza, water nasal discharges, then a viral infection like influenza most likely. Viral fever typically give loss of body headache and coryza. The require only symptomatic treatment, give a tablet of paracetamol, antihistaminic and anti-cold formulin like Virual and Distrol. For quick relief, injection like Novalgin plus paracetamol 2 cc/IM. Give if body and severe stronger analgesic like Proximon or Teramidol. Viral fever do not require use of antibody, but you are general practice, so don't take chance. So give ampicillin and ciprofloxacin. Precautions when every you have flu-like fever, 99.9% simple viral fever, but you should aware of hemorrhagic viral fever, dengue fever, especially in mosquito infection. These has similar symptom of high fever, coryza, body headache and headache. In addition, if there are practical hemorrhagic and measles like rashes on this skin, of there is bleeding the gums and nose, or if the pulse rapidly down, if the patient is restless, usually with cold clamming, pale skin, so severe condition of dengue, hemorrhagic fever, rapidly infection, IV fluid and fresh blood to patient. The treatment is to given ILU. The job of GP is to suspect, make or early diagnosis. These early diagnoses can be made by a low platelet count, so make it a rule that whenever test blood for fever, always ask for platelet count along the hemoglobin, WBCs, viral test and MP. If the platelet count of lower side, say less than 1 lakh repeatedly every alternate day, and get dengue IgG and IgM test done. Another way, if a patient high fever complain of body headache, always test for neck stiffness. It may be simple headache, but never fail to detach neck stiffness, meningitis. Now, lastly, let me tell you protocol of examining a patient with fever. Look at the conjunctiva and tongue for pallor, inspect of throat, good torch of pharyngitis and pyelonephritis and tonsillitis, inspect the sclera jaundice, palpate the neck of lymph nodes, the palpate the neck of lymph nodes and test the neck stiffness. Check the pulse of tachycardia, BP, palpate the abdomen of liver, spleen, oscillate the chest roll, bronchi, bronchiole, sound or breath sound, expected the tachycardia and murmur the heart and inspect the leg for edema and skin, ptysis and rashes. it takes next time. Actually examine the patient, the time taken to describe it and parasites you examine while you are asking the asking his to, so it takes no extra time. That important thing is the train your self examination every patient symptomatically and slowly till everything become relaxed. If next time lecture we will learn more about fever without chills and prolonged fever. Thank you very